So part two is going to be a lot about the specific medication, and we're going to start with clozapine, which is the most effective of the second generation antipsychotics. Unfortunately, though, the profile of danger for adverse reactions is such that we very rarely use it, and you have to actually justify why it's being used. So your practitioner has to basically say, hey, I tried this medication, and this medication with this medication, and nothing works. So now I'm doing clozapine as a last resort. And the reason for this is because there's extreme risk of a granulocytosis with this medication. So it requires weekly blood draws to monitor the absolute neutrophil count, also as the lab test ANC, absolute neutrophil count. And this is to monitor for that agranulocytosis that can occur. There are 3 black box warnings for this medication: one for hypotension, one for seizures, and one for agranulocytosis. And the seizure risk is going to be increased at higher doses, especially ones that are over 600 milligrams per day. And so it is definitely a contraindication for individuals who already have seizures, such as those with epilepsy. So constipation can also occur, hypersalivation, and so the individual who is taking this medication may need to chew gum, use hard candy, or other medications to reduce it. You're also going to see the probability of tachycardia with individuals who take clozapine, where the heart rate can be increased as much as 20 to 25 beats per minute. So you can imagine it might be contraindicated in patients who already have cardiac problems going on. Again, the white blood cell count with the ANC is going to be monitored weekly for the first 6 months and then every 2 weeks. And so as it's monitored weekly, the person who is getting the medication is going to have to go to a special pharmacy that actually prescribes it, because not very many of them do. And so it can be hard to locate where they are going to obtain the medication. It does have a weight gain possibility of 2 to 6 kilograms, and so you are going to see that you're going to have a high probability of metabolic disorders, including weight gain and diabetes. It also lowers the seizure threshold again, and interestingly, smoking is going to increase the metabolism of clozapine. So if they cut down on smoking, the levels of clozapine are going to rise. And so that is something to be aware of, because you want to teach your patient, if you're going to stop smoking, please let your practitioner know, because obviously if the side effects, if the medication levels rise, we're going to see the side effects rise as well. The next medication I'm going to mention is risperidone, which is also a second generation antipsychotic, and it does come in a long-acting injection called Risperdal Consta. It is used to treat schizophrenia, and it is used in agitation in elderly patients who have dementia and in bipolar disorder as well. There are higher EPS symptoms with this particular one as compared to other second generation antipsychotics. And it does have a possibility of hyperprolactinemia. So you're going to see with higher levels of prolactin, you're going to see breast tissue development, sometimes in male patients or things like that. It can cause QTc prolongation, so it is going to be a contraindicated medication in individuals who have certain types of heart disorders. You see hypotension that can result from Risperdal administration, and again, endocrine problems, including that increase in prolactin and some glucose intolerance that can develop. As far as EPS symptoms go, TD, tardive dyskinesia, is reported in doses of Risperdal that are greater than 6 milligrams, and orthostatic hypotension in the elderly is also going to be affected when you have higher levels as well. The weight gain for it is going to be moderate at 2 to 3 kilograms, and so that's not quite as high as some of the other second generation antipsychotics. Now let's go to olanzapine, which is going to have the highest weight gain profile. This is also known as Zyprexa, and it comes in a long-acting injection of Zyprexa Relaprev. It is indicated for the treatment of schizophrenia and bipolar mania. It is frequently a code drug that is used when you have an emergent situation where somebody is very agitated in the emergency department or in the psychiatric unit. So it is one of the most frequently administered of the second generation antipsychotics on an emergent basis. It does cause orthostatic hypotension, sedation, and it can induce seizures in about 0.9% of individuals. EPS symptoms can occur, including significant inner restlessness, also known as akathisia. Liver function tests increased in 10% of the patients, but returned to baseline with a discontinuation of the medication. And so this is something that you should be aware of because that the liver functioning can be affected, and we want to make certain that in individuals with hepatic disease that this is a medication that might be contraindicated. There is a high risk of metabolic syndrome with this medication, including weight gain and diabetes, as we already talked about. The long-acting medication is associated with delirium sedation syndrome, which is caused by a rapid rise in the blood levels of the medication. So once you give this, you're going to monitor for 3 hours for signs and symptoms of sedation, agitation, or disorientation. And obviously, because it's a long-acting form, this could go on for some time, and so you're going to manage symptoms. And this is probably why we don't see Zyprexa used quite as often in a long-acting as we do some of the other ones. It does come in a combination product, which is kind of nice because it is mixed with an SSRI and also with the Zyprexa. And so what happens with that is when you have treatment-resistant depression that's not responding to an SSRI, it can be quite good for patients to be able to take one medication that really is effective for treatment of their problem that they're having. And the name of that medication is Symbyax. Now let's go to the next one, quetiapine, Seroquel. This has a high sedation profile, so you'll often see this given for patients who have a lot of trouble sleeping because it is going to be very sedating, and you might see it administered at night for that reason as well. It's for treatment of psychotic disorders, and the EPS symptoms and prolactin elevation are very minimal. Again, it's very sedating, so it's often used in low doses for sleep. By the way, Zyprexa can also be used in low doses for sleep, especially if you're trying to develop a good sleep pattern. So like somebody who's had bad sleep hygiene and they're trying to reestablish a good sleep pattern, you might see it given at a very low dose for some length of time and then gradually weaned. And after a couple of months, then you're weaning them off the medication. Agitation does occur in elderly with dementia with administration of this medication, especially in Parkinson's and bipolar disorder as well. There can be postural hypotension that occur, EPS symptoms, headache, sedation, dizziness, constipation, and seizures in 0.8%. And in animal studies, they've had some development of cataracts with this medication. Ziprasidone is the next one, and this one does have a black box warning because it can be absorbed through the skin and can cause problems. So you want to be sure, especially if you're pregnant, that you're not administering this medication, not using gloved hands, and you have to be very careful with administration of this medication. It is given in injectable forms, and it can also be given as a pill form, but in an emergency situation, that injectable form works much more quickly. It is used for the treatment of schizophrenia and frequently is an emergency drug because, again, it does act very quickly to reduce agitation. QT prolongation can occur, so again, it's one of those that is going to be contraindicated when you have persons that have heart disorders already. An ECG is not required at baseline, but you definitely want to use with caution in heart abnormalities, electrolyte imbalances, where there's already a prolongation of QTC especially, and with concurrent medications that also prolong QTC. So if you have other ones that are being administered that prolong the QTC, it's going to exacerbate the effect of the Geodon on that. You will see nausea, headache, somnolence, dizziness, and EPS symptoms in about 5% of individuals, and constipation with administration of this medication. And you can see a weight change, but it's minimal compared to other second-generation antipsychotics. It is best to take it with food if you're doing it through the oral route to increase the absorption of the medication. So here are a few other medications that are available in long-acting, and one of them is Invega Sustenna, Invega Trinza, Abilify Maintaina, Aristata, Haldol Decanate, and Prolixin. Now, I will let you know that these long-actings are used very frequently because think about it, when you have individuals who are maybe not quite as compliant, they've been court-ordered, you want to try to get one of these on board because it will keep them stable for a longer period of time. So you are going to see your patient coming in every month and a half instead of every 8 or 9 days. So they can be quite helpful with that. Now, obviously, Haldol Decanate is a first-generation antipsychotic, but so it does have that EPS symptom profile that the other ones don't. Abilify Maintaina is a wonderful medication because it works on both the positive and the negative symptoms of schizophrenia and other psychotic disorders. But the problem with it is that it's very expensive. And so once a month, you give them this medication, and it costs about $1,500 a time in order to get it. Fortunately, the state of Oklahoma has taken on the idea that we need to keep our patients stable, so they actually will provide this injection to patients. And by the way, there is also some different profiles related to these medications that you'll learn in practice. For example, Abilify, they want to start on it for a few days before they give it to make sure the long acting isn't going to have a reaction. For Invega Sustenna and Invega Trinza, there are some very special things that you do with regards to administration and how you administer it, like you administer half a dose and then you administer another half. So those are very specific, but you will learn those when you work on a psychiatric unit as to how it is going to be administered. Now let's talk about Abilify or aripiprazole. Sorry, I didn't close my parenthesis here. Aripiprazole is a wonderful medication, and again, it is something that has a low risk for metabolic disturbances, and it does come in that long-acting injection, so it's one of those that we use pretty frequently. Prolactin levels are low with this, and it may cause rare cases of compulsive behavior like gambling, shopping, or sex, which obviously would be very problematic. But it is great for the negative symptoms of schizophrenia. So as my representative would tell me as they came to sell us the Abilify, they would say, so your patient not only has a reduction in hallucinations, but they get up and they take a shower and they start to actually, function and to socialize, which are negative symptoms of schizophrenia that are not cleared up with other antipsychotics. So it's a really exciting medication to be able to give to our patients when they are suffering from a psychotic disorder that has been quite life affecting. Now let's talk about paliperidone or Invega. It does have hyperprolactinemia as a possibility. The tablets do not fully dissolve, so you need to teach your patients to avoid or to actually be able to know that their shells of the medication may appear in their stool, and avoid in patients with severe GI narrowing. It is a good long-acting in the Invega Sustenna or the Invega Trinza form, and the good thing about Trinza is it actually comes in a 3-month instead of a 1-month version, so you can keep your patient stable for longer. The next medication I have never seen in practice, but is iloperidone or Fanapt. It does cause dizziness and orthostatic hypotension as a possibility. You're going to slowly titrate the dose on initiation to minimize these symptoms, and it is associated with QT prolongation, and again, you don't want to stack the QT prolonging meds or that can be problematic. The next one is lorazepam and asenapine. Lorazepam has a low risk for QT or metabolic disturbances. You take it with food to enhance the absorption. The Saffris is frequently used in kids' units because it comes in a sublingual or a patch, and so you do need to educate your patient on how to take a sublingual pill under the tongue and not eat or drink for 10 minutes and make certain that they let it fully absorb under the tongue, because if they actually swallow it, they only get about 2% of it bioavailable. It causes a numbness or tingling of the mouth sometimes, which is called oral hyposthesia, and it usually resolves within the hour. It can be sedating and it can cause orthostatic hypotension. The next one we're going to talk about is brexpiprazole, which is Rexulti, and is similar to aripiprazole. It's unlikely to increase prolactin levels and rarely causes compulsive behaviors, and it has a low risk for QT prolongation or metabolic syndrome. Vraylar or carbaperazine is very new. It has high rates of EPS, a longer half-life, and the response to treatment or side effect development may take several weeks to appear. Caplyta, a lumateperone, I've never seen that one, so I don't know how to pronounce it, has a lot of risk for EPS symptoms and metabolic disorder, is sedating with high levels, causing drowsiness, and valproate may increase serum levels and risk for side effects. So if they're taking it with valproate, that could be a problem, and you want to take it with food. Okay, this concludes our specific medications, and now we're going to talk about nursing specific interventions.